In the fall of 2000, I was diagnosed with breast cancer. I was assured that this diagnosis was just a little bump in the road of life. But this diagnosis changed my life in a profound and permanent way, in a way that I never could have foreseen. I was shocked when test results came back positive for hepatitis C. I had no risk factors, no explanation of how I had contracted this mysterious disease. As the doctor questioned me about sexual practices and substance abuse, anxiety welled up within me. The questions embarrassed me so much that I could not meet the eyes of the healthcare providers as I quickly exited the building. I walked the labyrinth of hallways with anxiety and confusion increasing with every step. I did not know how I would pull forward the courage to go forward in a life with hepatitis C, if I should be able to survive the breast cancer. I did not know how I would go forward as a wife, mother, and healthcare provider. I was so stigmatized by the diagnosis that I told no one about it. I walked this lonely road of worry all by myself. I did not want anyone to know that I had a disease associated with risky behavior. I was afraid that I would be judged a sinner. Public health authorities investigated and found that 99 of my fellow cancer patients had contracted hepatitis C through unsafe injections. Hepatitis C had huge repercussions for patients, their families, the medical community, and the community at large. People suffered emotionally, physically, socially, and financially. At least 6 people died, not from the cancer, but from hepatitis C. The resulting 89 lawsuits divided the community between supporters of the medical system and supporters of the victims. I would venture to say that many in the community are still struggling to overcome the effects of the disaster, now 15 years later. I know that I am. I grieve for the families who have lost loved ones to the disease. I feel betrayed by a healthcare system that transmitted a life-threatening disease to innocent victims. In their honor, I am working to prevent what happened to us from happening to anyone else. We used my malpractice award settlement to provide the seed money for Hepatitis Outbreaks National Organization for Reform, or Honor Reform. Honor Reform is dedicated to prevention of viral hepatitis through injection safety. I vow to never again allow stigma to be part of my life, and I speak out against it with every opportunity. It is rewarding to share my experience with others and to share my hope about life with hepatitis C.